I'm Ruth. I'm a professor and chair of medicine at the University of Rochester. When we treat patients with metastatic breast cancer, we sometimes see patients which we refer to as an exceptional responder. And what does that mean? Well, it basically means that they kind of have, if you like, beaten the odds and really had a really very sustained benefit from a given agent. So I'll give you an example of one of my patients with this. So I had a patient, she was in her 60s. She had metastatic triple negative breast cancer, and I initially treated her with some chemotherapy, which didn't work that well. I then put her on a clinical trial, which that didn't work very well either. And I think she might have got one more line of chemotherapy. But then I ended up putting her on a clinical trial with eribulin, a chemotherapy agent, along with pembrolizumab, which is obviously a checkpoint inhibitor. And her disease was mainly in her lymph nodes. And what I found was that the first scan, she looked about pretty stable. The next time I scanned her, the lymph nodes had got smaller. And then by the third scan, there was no lymph nodes to be seen at all on her scan, and nothing, couldn't palpate any lymph nodes. There was nothing on her scans. And that was probably about 2 years ago. And during that time, she did develop some toxicity from the pembrolizumab. So she developed some kidney toxicity. So I had to stop the checkpoint inhibitor, but I left her on the chemotherapy. She has remained in complete remission since that time. In fact, I started doing scans less often on her because they were essentially clear. Now, I don't know what will happen with her, but for metastatic triple negative breast cancer to be 2 years with this kind of a response is really quite remarkable. And I had another similar patient who was on the same trial, and she also, after it took a few cycles, but she also had a complete response. She ended up stopping both of the drugs, and that was again about 2 years ago, and she has received no systemic therapy since that time point. So I haven't given her any treatment, and her scans have remained completely clear. So this really illustrates what I think oncologists, non-breast oncologists have known for a long time, and that is that in a subset of patients that receive immunotherapy, they really have a really incredible response that most importantly is sustained for years. And, we know that metastatic triple negative breast cancer, the median survival is between a year and 18 months. And both of these women are just basically living with no evidence of disease. And one of them is on no therapy at all. So I think it's just really an incredible response. So this is the beauty of immunotherapy. And I think why we're so excited about it is that you get these patients that really have these incredible responses.